Starting from the beginning, I guess, I was a very well-paid executive in the healthcare industry. I was what you would call executive healthcare consultant, and I've worked all over the world doing that, consulting with hospitals and hospital IT and systems implementations and so forth. Very good salary. And I found myself in a position in my late 50s, just about to turn 60, of being aged out. And I couldn't get back to work. I had a significant savings. It didn't take very long to go through it because obviously you're living at the same level that you were living when you got laid off. And consequently, when you lose your employment, you lose health care because health care is tied to employment and so forth. And I wasn't at the age of 65, so I wasn't able to get Medicare. I had two chronic conditions, hypertension and diabetes. And I had gone to several community organizations for help after my unemployment and everything had run out. And I was told that there was a service in the community, and if they accepted you, they would take care of your health care needs and they could get you medication. And sometimes they did it at a very low cost. So I ended up finding the Health and Hope Clinic through one of the community referral organizations, if that answers your question. Once I came in, they gave me, first of all, they took a financial application and medical history and so forth, and they started to give me the drugs that I needed for my chronic condition. During that process, I contracted MRSA and pneumonia, which I didn't even know I had. One day I was fine, next day I wasn't. Following a couple of days, I was in the hospital flat on my back, needing surgery and so forth. Help and Hope was not involved, not involved in that portion of it because I ended up going to West Florida simply because it was the closest to my home. Once I was there, they discovered a mass on my left kidney. So in addition to the other problems that I was having, which were exacerbated by my chronic conditions, they found this mass. So to make a long story short, they took care of my immediate needs. I got the surgery that I needed and so forth. And then they said, you're going to need some follow-on care, which of course meant I would come back to Health and Hope for my outpatient treatment. When I came back here after discharge, they determined that in order to figure out what the mass was, I needed an MRI. So they worked with Baptist and they got me an MRI.
That's okay.
The first illness actually saved my life because once Health and Hope did sponsor the MRI and we got the result back, it turns out I had a 5-centimeter tumor in my left kidney. And it was very close to getting into the lymph node. We were able to get me booked at Baptist with one of the surgeons who agreed to do the surgery. And we were able to remove the mass, and they put me in immunotherapy. I was in immunotherapy for over a year. And since that time, I've been cancer-free. I'm going, I think it's my 3rd year in March. When I go for my next scan, hopefully it will come up clean and we'll be okay.
Mr. Scott, is this health care that you would not have been able to get had you not found these guys?
I can tell you without a doubt, I wouldn't be sitting here. had I not been able to get that health care through this clinic. This clinic saved my life. I didn't even know I had the illness. I had no clue. I didn't feel anything. Had I not gotten ill with the MRSA and been admitted to the hospital with the pneumonia, and they were trying to get all of my other bodily functions in balance and so forth, had it not been for that incident, we would have never had a reason to do an MRI unless some other symptoms had popped up. I think at that point, I was under, no, I wasn't under Medicare because I wasn't 65, so I hadn't even qualified for Medicare. I was able to retire at 62 and get Social Security. And because of that, I was in line to get Part A or B at 65. So during the donut hole, I had absolutely no coverage whatsoever. And my story is not unique. There are many, many, many senior people being let go that are in that very vulnerable area and don't have coverage. Yes, you can get COBRA, but who can afford it? When you're unemployed, it's way out of the realm to carry COBRA insurance. You can't even imagine. And the unique thing about my situation is I know the mechanics. I know where the bodies are buried. I understand health claims and those. I've worked with it for years. I'm the guy that sat on the work group that designed and drafted the HIPAA legislation, okay? So when I walk into a hospital, there is no area in that medical community that I cannot function and do not understand the intricacies of how it works and the mechanics. And I couldn't understand for the life of me, with that kind of experience, why I couldn't get back into the workforce. And the only thing I can think of is that it was age and experience level, because obviously I'm very expensive. And at that point, I didn't really have the wherewithal or the energy to go out and start my own consulting agency again at almost 60 years old, you know. And at the time I had the surgery, I had just turned 60. I hit 60 at the time I had surgery. Had this clinic not been in existence, I probably would have ended up maybe at a county health facility or something, and I doubt that I would have gotten the care that I needed because the funds and the facilities are so limited.
You're living proof, in my opinion, that it really isn't just about the fact that, yes, there are some that are unemployed that can get the help that actually a working man could not.
Correct.
And you fell right perfectly into that, what you call the donut area.
Mm-hmm.
But I'm not sure most people know how vulnerable. Here you are working all your life, doing what you're supposed to do, and you get left out. Could you address that just a little bit?
I was not mentally prepared for what happened. Not just physically, but socially, psychologically, none of it. And you're right. I have been lucky enough to have worked all over the world as a civilian, not as in military. I did a lot of military service, and I got out and I came directly to the healthcare industry. And I've been fortunate enough that I served 4 years in Saudi Arabia helping them rebuild the hospitals after the Gulf War, the original Gulf War. I went from there to Kuwait for 4 years, and I helped bring in the first integrated medical system in the country. They had never had a hospital computer system before. I went from there, came back to the States, and I worked for various consulting agencies in going to different hospitals and so forth and so on. I ended up going to Puerto Rico to work for Blue Cross and Blue Shield. I came back to the mainland and worked for several other healthcare organizations, and I ended up going to Hawaii for a year to work for Blue Cross and Blue Shield again. So having all of those things in my background, I thought that my future was set. And to answer your question directly, there are many, many people who fall into that particular donut hole because not only the healthcare industry, but industry as a whole in America is not set up to keep people going. It's more or less, we get employed, we give our best, we attend the schools, we give up weekends, we give up holidays and those kinds of things. I can't tell you how many holidays I had to end early and go to the airport because I needed to be in Minneapolis Monday morning. And when all of this happened, I felt rejected, I felt less than, I felt shut out. And I also went through a divorce, just previous to that, so it just compounded the problem. And spiritually, I felt dead. It's very difficult sometimes to look back on from whence I've come to where I am now, but at least now I have peace. I've adjusted. I realize that there's no getting back in. I have tried, and I've just resigned myself that it's not going to happen. About 2 years ago, maybe 3 now, Sally asked me if I would be their guest speaker at the annual fundraiser, and I agreed to do it. It was probably one of the most rewarding things to me that I've ever done because it gave me an opportunity to express my gratitude for them basically saving my life and hopefully inspiring the people in the room to continue doing what they do to support the clinic and the operations, because I can't directly speak for the people who come through those doors, but I can tell you, if this facility were not here, and in particular at this time in our history, in the turbulence, and the many people that are losing their jobs, we would be in a very, very different place. We need more facilities like this. And I wish I could do more. And hopefully this interview will inspire some people to give, to support either money, time, it doesn't matter, to help this facility and others like it flourish, because we need it. We really do.